Hi guys, my name is Tiffany and welcome back to another video. So I thought in this one I would share with you how to make the most out of your clinical experience while you're in nursing school. So it's been a while since I graduated nursing school, but I do actually orient a lot of new hire, new grad nurses, and I do shadow a lot of nursing students as well, so I thought I would share with you guys some of my tips. So the first tip that I have for you is to let your preceptor or the nurse that you're shadowing your limitations. So just letting them know what you can and can't do, because I know a lot of nursing schools want to have their clinical instructor there to give medications, for example, or there's some schools that don't let you do certain types of procedures like give immunizations or things like that. So it's very helpful when I have my nursing student, and I usually will first ask them what their limitations are and what they can and can't do. So the next step I have for you is to have an open mind and be willing to put yourself out there. So the first thing I'll usually let my nurse know when I greet them is that if there's any learning opportunities that I would love to help and assist as much as possible. There's also trying to find a fine balance between not being super overeager as well. Don't try to be that nursing student that thinks they know everything and that they know more than their nurses, because a lot of times these nurses have a lot of experience. So it takes a lot of patience to be able to teach nursing students, because a lot of times we want to try to do our best to be able to be as informative as much as possible. And sometimes this will allow us to be behind on our patients. And so we try our best to want to teach you guys. So it's just better to let your nurse know if you can help them as much as possible to their comfort level. And usually a lot of times the nurses are very excited and very thankful that you're willing to help out. So next tip I have for you that's super important is always thank your nurses. A lot of times nurses don't get any extra bonuses or anything for being able to teach nursing students. So just be thankful to them that they're there and that they're willing to help you guys. The next tip I have for you is to have a positive mindset. So there's not a lot of times where you're going to be able to see cool things on the unit or be able to assist in procedures, but just be thankful to the nurses that are willing to help you and for them to be able to shadow you around the unit. It takes a lot of patience and a lot of time for nurses to be able to educate. So always make sure to thank your nurses. So the next tip I have for you that is super important is maintaining professionalism. So clinicals is not a time for you guys to be chit-chatting with your friends or hanging out with them. You're here to learn and gain opportunities. So don't forget that you maintain an image for your school, and so you want to create a perfect image so that way other nursing students are able to come back in the future and be able to come back to the hospital to be able to learn as well. The next tip I have for you that's also really nice is when you know where things are on the unit. So it's very helpful, like let's say, for example, your nurse is busy and cannot leave the bedside. If they need to grab something and they forgot to bring it into the room or whatever, it's really nice to have the nursing student be able to be proactive and help grab supplies. And also it's just nice where things are, like for example, where the water room is or where to grab linen. That way, if your patient needs something and your nurse is busy, if you can help and assist in that way, that'd be super helpful for the nurses, and I'm sure they'll be very, very thankful. And lastly, this is a bonus tip for you guys. Always carry a notebook with you to clinicals, and that way at the end of their shift, write down what went well and what didn't go well that day, and also anything you got to see that was cool that day. And that way when you go home, you can do a little bit more research on it. And also when you're doing prep work for your interviews and landing that new grad job, that you have actual clinical examples from your clinical experiences that you can use to answer these questions. So I hope this video was helpful to you, and I hope you guys enjoy your time during your clinicals. It's a lot of fun and you guys will learn so much. If you guys have any other questions or anything else you would want me to make videos of, leave it down in the comments below, and I'll see you guys in my next one. Bye! Anywhere you feel right,